Here with us are twin doctors, Idris and Jamil Abdur Rahman. Doctors, welcome back. Great to see you.
Thanks for
Great to see
having
you as
us.
well.
Dr. I, I'll start with you. Let's start with the players. How has science evolved to protect our favorite athletes and prevent brain injuries, and has it developed enough?
The short answer, no, it has not developed enough. What these people are suffering from is something called chronic traumatic encephalopathy. And so chronic meaning long-term, traumatic, trauma, pretty obvious, encephalopathy, swelling of the brain. It's basically a sick brain. And it's from constant trauma, constant hits, constant hits, constant hits. And so no, unfortunately, science has not developed to the point that we can actually prevent this or even do much to reduce its effects.
Dr. J, many American families, as you well know, have been affected by degenerative brain diseases. I do want to start with Parkinson's. Can you talk to us about the symptoms and the treatments out there?
Yeah, so typically the symptoms are going to be symptoms that involve movement. Although when we think of Parkinson's, most people think of the tremor, and that's certainly one of the more common symptoms. But there's also going to be cognitive symptoms as well. And so oftentimes people with Parkinson's may feel forgetful. They have a hard time concentrating. You can see changes in sleeping patterns where someone's sleeping more than they did before, or they're sleeping less than they did before. You can also see changes in mood and affect. And so you may feel that they're moody or they're just not themselves. In terms of treatments, there are a lot of medications that basically work to downregulate the activity of the portions of the brain that are too active in Parkinson's. And there are even doing some treatments now that involve changing the effects of the circuitry or the electrical circuitry in the brain that is misfiring when you see a patient with Parkinson's disease. But to date, unfortunately, while we're able to improve the quality of life for a certain amount of time, you do still see that downward track as the disease progresses.
Dr. J, let me stick with you for a sec, because it's not just athletes who are being diagnosed with Parkinson's, but I have to ask, is playing contact sports really increasing your risk?
I would say playing contact sports absolutely increases your risk of not only Parkinson's, but a variety of degenerative diseases. And part of it comes down to inflammation, right? When you talk about most diseases in the body, it comes down to inflammation. Chronic head trauma causes inflammation. Inflammation basically causes proteins in the brain that normally function doing one thing to do something completely different. That causes brain cells not to function properly. It causes brain cells not to communicate properly. And it can lead to Parkinson's, but dementia, even things like anxiety and depression. And kind of like Dr. I was saying earlier, steps are being taken. We had these Guardian helmets in the NFL,
Yeah.
for example, and they diminish some of the force being applied to the brain, but not by much, by about 10%. And so, yeah, these contact sports play a huge role.
Dr. I, this week, another big health announcement, this time from a beloved player from the former Minnesota quarterback, Tommy Kramer. He announced he has dementia. So is this another mental disorder that is increased by concussions?
Absolutely, absolutely. So when we think of concussions, we think of something that happens acutely, right? But what happens is when you have this chronic trauma, which a lot of football players do, and not just football players, but rugby players, people in contact sports like this, yeah, you have this chronic inflammation, like Dr. J was saying. So you get this deposition of these proteins in the brain, and overall, you end up getting shrinking of the brain. That's what the encephalopathy is. And so, yeah, absolutely, we're going to see more Parkinson's, more dementia, more depression, more anxiety. You see a ton of mood disorders in people that have concussions frequently or CTE.
Dr. J, Dolphins QB Tua Tagovailoa suffered a third concussion during his NFL career just this month. He's been benched ever since. What are doctors looking for when examining if he should or could play again?
Well, that's kind of the tough part of it for the doctors. I mean, acutely, when you've just had the injury, you can do what are called mini mental status exams. You can check what are called the cranial nerves, things of that nature to get an idea of acutely whether or not there's been some brain injury. But long term, there's not a lot of testing that can predict what may or may not happen. And so, a lot of people are questioning, well, should he continue playing? And obviously, that's a tough question to answer because things like CTE or dementia or Parkinson's, they're multifactorial, and the blows play a huge role, but there's also environmental factors. There's even genetic factors. We know, for example, there's a protein, or I should say a gene called APO4, that if people have that, they're at higher risk for developing things like CTE and dementia and Alzheimer's down the road. And so it's very difficult at this point to determine, just by examining him at this moment, whether or not he should or shouldn't play. Three concussions, though, that's certainly an indication that he's one of these people who is at higher risk for brain injury, and
Mm,
it would be certainly worthwhile considering maybe hanging it up. But it's very difficult for any
yeah.
doctor to accurately assess at this point.
Sure. Dr. I, chronic brain illnesses affect millions of people. Not everyone has access to great preventative health care. What can we be doing to protect our cognitive functions as we age?
There are really quite a few things. So there are actually tons of apps. There are exercises you can do to just keep the brain healthy, right? You want to keep the brain healthy. You want to keep the brain active. So things like Sudoku, things like that help. Ginkgo biloba. There are certain supplements you can take as well. But even if you don't have access to some of the best doctors, seeing your primary care doctor on a regular basis is still important because, like Dr. J was saying, chronic inflammation plays a big role. And so probiotics, things like that help as well. But seeing your doctor on a regular basis, having these mini mental status examinations done, make a big difference because these things don't happen in short order. They happen over time. And so if you're seeing your doctor on a regular basis, that's something that can be caught. But yeah, there's certain things you can do. You can do supplements, you can do brain health exercises, but really seeing your doctor on a regular basis is the most important thing.
Always great advice from both of you, Dr. Idris and Jamil Abdul Rahman. Thank you for coming on.